Hello, doctors. So today I'm going to talk about the simman asthma station. So in this station, as soon as you enter the cubicle and you look at the monitor, you'll find out that oxygen saturation is low and respiratory rate is high. The blood pressure is usually normal. Okay, so and the patient, as soon as you enter the room, you will realize that the patient is coughing a lot and there are labored breathing sounds. Okay, so as soon as you walk to the patient, you introduce yourself and you confirm the patient name. The patient will be telling you, "Doctor, I can't breathe," and you will be coughing. Okay, so similar type of scenario also happen in anaphylaxis station. So just to differentiate, you will ask the patient, you will tell the patient that, yes, Mr. Smith, I'm here to help you. Can you please open your mouth for me? And you will have a look inside his mouth just to make sure that there is no swelling of the tongue or lip mucosa. And then you will tell the patient that I can see that your oxygen saturation is a bit on the lower side. So I'm going to give you oxygen. Do you have any smoker's cough? Okay, and the patient will say no because it's an asthma station. So you will start the patient on oxygen. You will verbalize that I'm going to start my patient on 100% oxygen, 15 liters per minute when on rebreather mask. You will pick the mask and you will put it around the patient's mouth, okay, and nose. All right, and then you will check the monitor again. There might be some improvement in the oxygen saturation. So the airway part is done. Then you will move on to the breathing part. You will tell the patient that I'm going to have a look at your chest, please. You will expose his chest and you will do inspection, then palpation, and then percussion and auscultation. So on auscultation, you will hear wheezing sound. Okay, there will be wheezes. So this will confirm your diagnosis of asthma. To make sure that you are able to recognize the wheezing sound, you can search them on YouTube. And like there are two types of additional lung sounds that are there in the seventh station. One is wheeze, and the other is crackles. The wheezes are there in the asthma, and the crackles are there in heart failure patients. So just make sure that you are able to pick these two sounds. Okay. All right. So once you find that there is wheezing on auscultation, what will you do? You will tell the patient that I'm going to give you some medicines through your mask, and you will verbalize it. I'm going to give my patient salbutamol 5 mg driven via oxygen. Okay, salbutamol 5 mg driven via oxygen via nebulizer masks. Okay, so you will go up to the medicine cart. You will pick the nebulizer mask. You will pick salbutamol, and you will start the patient on lead. Okay, if you do not find these things, just verbalization will be enough. If these things aren't there or they are somehow misplaced, the examiner will tell you assume it. Okay, all right. So after you start the patient on salbutamol 5 mg, you will again check oxygen saturation. If the oxygen saturation is still low, you will repeat the dose of 5 mg salbutamol. Okay, and after that, again, you will check oxygen saturation. If oxygen saturation is still low, then you will start the patient on 500 microgram ipratropium bromide. Okay, so oxygen, after oxygen, salbutamol driven by oxygen 5 mg via nebulizer mask. After that, repeat the dose of salbutamol, and after that, 500 microgram ipratropium bromide. So doctors, you will be following all these steps if the oxygen saturation is not improving. If the oxygen saturation has improved and it's already about 95% with salbutamol 5 mg first dose, then you are just going to you are not going to add anything, and you are going to proceed to the circulation part. Okay, so after ipratropium bromide, you proceed to the circulation part. You check the pulse, you check the blood pressure, and you check the oxygen saturation again. If it is still low, then you are going to give the patient IV hydrocortisone 200 mg. So you are going to verbalize that I'm going to give my patient 200 mg hydrocortisone IV state, and for that I need to open an IV access. Okay, and you will go up to the medicine cart and you'll pick this medication. You'll tell the patient that I'm going to give you some medication to your vein. Okay, but please keep in mind that this is the last step that you are going to do as a junior doctor. You are not going to proceed uh, from there. You are not going to give IV salbutamol. You are not going to give IV magnesium sulfate because it doesn't come under your jurisdiction as a junior doctor. So when you give IV hydrocortisone, at the same time you will verbalize that I'm going to inform one of the member of the ITU team because the patient may need transfer to the ICU. All right. So you are going to verbalize this. I'm going to inform one of the member of the ITU team because the patient may need transfer, ICU transfer, and assisted ventilation. Okay. And you will say, I'm going to inform one of my seniors as well. All right. So these are the steps that you are going to do. You're going to start the patient on oxygen 100% by non-rebreather mask, 15 liter per minute. After that, 500 salbutamol driven by oxygen through nebulizer mask. And repeat the dose. Still not improving. 500 microgram of bromide. Still not improving. IV hydrocortisone 200 mg. And still not. And while giving IV hydrocortisone 200 mg, you are going to inform your seniors and you're going to inform one of the member of the ITU team because if the patient has not improved after giving IV hydrocortisone, the patient needs ICU transfer. Okay. All right. So if the patient improves after giving IV hydrocortisone or any like any other step in the process, you're going to move ahead to the C, D, and E part of the ABCDE pathway, and you are going to, after you are done with your assessment, you are going to take a short history. When did it start? How did it start? Did you take your liver medications today? Have you been diagnosed with any medical conditions at all, any allergies, any other medication that you might be on? Okay. And then you're going to tell the patient, we are going to keep you admitted today, and I'm going to inform my seniors. We are going to keep you admitted today. I'm going to inform my seniors and they are going to review your medication. So these two steps go for all the patient, that you are going to admit them and you're going to inform your seniors because all of them on station, they are acute emergencies. All right. So that was your asthma simman station, and I'm going to see you again with another simman station very soon.